If you're over 60 and you check your blood pressure at home, I want you to stop focusing so much on that top number for the next 20 minutes, because there's a second number sitting right next to it on that little screen that almost nobody ever asks about. And according to a growing body of research, it's far more strongly tied to stroke risk than most people realize. By the time we get to the end of this video, you're going to know exactly which number that is, why it matters so much more after 60 than it did at 40, and exactly what to do if yours isn't where it should be, without needing to wait for your next scheduled appointment to find out. I'm Dr. Hale Thorne. I've been practicing medicine for more than 30 years, and blood pressure has been part of nearly every single day of that career, because it's genuinely one of the most common things I manage in patients your age, walking through that exam room door week after week, year after year. And I'll tell you honestly, I check my own numbers more carefully these days than I did when I was 40, because the way blood pressure behaves changes as we get older, in ways that surprise a lot of people, myself included. Some mornings when I look at my own readings and think, well, that's not quite what it used to be back when I could eat whatever I wanted and never think twice about it. Before we get into it, I want to ask you for something. Down in the comments, tell me your most recent blood pressure reading, both numbers, top and bottom, and your age. I read every single comment on these videos, and it genuinely shapes what I decide to cover going forward, so don't be shy about sharing your numbers. There's no judgment here. Only information that can help you and help the people reading the comments alongside you. The way a community gathering around the same kitchen table tends to help everyone learn a little faster than figuring things out completely alone. Let's start with the basics, because I want to make sure we're all standing on the same ground before I tell you which number matters most. When you check your blood pressure, you get two numbers. The top number, called systolic pressure, measures the force in your arteries when your heart beats and pushes blood out. The bottom number, called diastolic pressure, measures the pressure in your arteries when your heart is resting between beats. For decades, most public health messaging focused almost entirely on that top number. Get your systolic under this threshold. Keep it under that threshold. And that's not wrong. That number absolutely matters. It's been the centerpiece of cardiovascular guidance for generations of doctors and patients alike, printed on pamphlets in waiting rooms for as long as I can remember. But here's what doesn't get explained nearly often enough, especially for people in your age group, and that's the gap between those two numbers, what we call pulse pressure, a measurement that quietly sits there on every single reading you've ever taken, doing very little to draw attention to itself, hiding in plain sight on a number you've probably looked at 1,000 times without ever once doing the subtraction. Pulse pressure is simply the difference between your top number and your bottom number. If your blood pressure reads 150/70, your pulse pressure is 80. If it reads 130/80, your pulse pressure is 50. It's basic subtraction, nothing complicated about the math at all, and yet in my 30 years of practice, I'd estimate that the overwhelming majority of patients have never once calculated this number for themselves, simply because nobody ever told them it was worth calculating. And frankly, until fairly recently in the broader history of cardiovascular medicine, even doctors didn't emphasize it nearly as much as the research now suggests we should. And here's why this single number deserves so much more attention than it gets. Particularly after 60, a wide pulse pressure, generally considered to be somewhere above 60, has been associated in numerous studies with stiffening of the large arteries. And that arterial stiffness is one of the strongest known contributors to stroke risk in older adults, often even more telling than either number taken on its own. In isolation, the way most of us were taught to read our own readings for decades. Let me explain why this happens, because understanding the mechanism makes this so much easier to actually act on. Think of your arteries when you're young as something like a fresh garden hose, flexible, able to expand and contract smoothly with every heartbeat, absorbing the force of each pulse the way a good shock absorber handles a bump in the road. As we age, those artery walls naturally stiffen somewhat, the way any material loses some flexibility over decades of constant use. The same way that fresh garden hose left out in the sun year after year eventually loses the give it once had and becomes more rigid against your hand. When the big arteries stiffen, they can't absorb and smooth out that pulse of pressure the way they used to, so the systolic number tends to climb, while the diastolic number often stays flat or even drops slightly, and that widening gap between the two, that pulse pressure, is essentially a window into how stiff and worn those major arteries have become. A wide pulse pressure isn't just a number. It's a fairly direct reflection of vascular aging happening inside your body right now, whether you feel it or not, often years before any other symptom would ever tip you off that something has shifted. This matters enormously for stroke risk specifically because the brain depends on a remarkably steady, well-cushioned flow of blood through small, delicate vessels, vessels far more fragile than the larger arteries we usually picture when we think about heart health. When the large arteries upstream have stiffened and lost their natural cushioning ability, that pulse of pressure travels further down into those smaller brain vessels with much less smoothing along the way, hitting them with more force, more directly, beat after beat after beat, day after day, year after year, like a small, persistent drip wearing down a stone over time rather than one single dramatic event. Over time, that repeated battering on small vessels is part of what researchers believe contributes to the kind of vessel damage that raises stroke risk, particularly the kind of small vessel disease that doesn't always announce itself with dramatic symptoms until something serious actually happens, often showing up only on imaging done for entirely unrelated reasons. The kind of silent finding that surprises both patient and doctor alike. I had a patient, a woman named Doris, 76 years old, a retired church choir director who still ran her household with the same precision she once brought to conducting a Sunday hymn, who came to me with blood pressure readings that honestly didn't alarm her at all when she looked at them herself, something like 148/72. By the standards she'd been taught to watch for decades ago, top number a little high but not terrible, bottom number looking just fine, even good. But that gap, 76 points of pulse pressure, was substantial. And it told me something her own self-assessment had completely missed, something that the two individual numbers, viewed separately the way she'd always been taught to view them, simply couldn't reveal on their own. We worked together over the following months, not with anything dramatic, simply more consistent walking, adjustments to her medication timing, less processed food, fewer of those convenient canned soups she'd grown accustomed to since living alone, and watched that gap slowly narrow over about 4 months from 76 down to somewhere closer to 58. She told me she didn't feel particularly different day to day, which is honestly the tricky part of all of this. This isn't something you feel. It's something you have to actually measure and pay attention to. The way you'd check the oil in a car not because the engine is making noise, but specifically because by the time it makes noise, the damage is often already done. Sometimes done in ways that can't be undone at all. Now, a quick pause here because if you've made it this far in the video, you're clearly someone who takes their own health seriously, and that already puts you ahead of a lot of people who'd rather not think too hard about what those two numbers on their cuff actually mean. Go ahead and tap that like button if this has been useful. It genuinely helps this information reach more people managing their blood pressure at exactly this stage of life. And let me know in the comments, when you calculate your own pulse pressure right now, top number minus bottom number, what do you get? I read every single comment every time, and honestly, some of the most interesting patterns I notice come directly from seeing what numbers people are reporting in those comments. Let me walk you through how to actually use this information because knowing the number means very little without knowing what to do with it. If your pulse pressure is consistently sitting above 60, that's worth a direct conversation with your doctor, specifically framed around this number, not just the individual readings. Ask directly, what's my pulse pressure looking like? And does it concern you, given my overall health picture? A lot of doctors, myself included on busy days years ago, I'll admit, focus the conversation on the individual numbers without always connecting the dot to this gap, simply because appointments move fast and there's a lot of ground to cover in a short visit. Blood work to review, medications to adjust, questions about a dozen other things entirely. Bringing this specific question to the table puts it directly on the agenda, and in my experience, most doctors genuinely appreciate a patient who comes in with a focused, specific question rather than a vague sense of worry they can't quite put into words. I've found that patients who write their question down ahead of time, literally on a small piece of paper they bring with them, tend to actually get the answer they're looking for far more often than those who plan to simply remember to ask once they're sitting in the room, because appointments have a way of filling up quickly with other things the moment they begin. There are real practical things that help narrow a wide pulse pressure over time, and none of them require anything dramatic or unrealistic. Regular walking, even moderate amounts, has been shown to improve arterial flexibility measurably over months of consistency, not overnight, but genuinely over time. The same kind of slow, steady improvement we've talked about in other videos when it comes to almost anything related to vascular health. Reducing sodium intake helps both numbers move in a healthier direction, particularly for people sensitive to salt, which becomes more common as we age. Our kidneys simply don't process it quite the way they did decades earlier. Managing stress matters more than people expect, because chronic stress keeps those arteries in a more... I also want to mention something that surprises a lot of my patients, and that's the role of consistent measurement itself. A single blood pressure reading taken once every few months in a doctor's office gives us one isolated snapshot, almost like judging an entire movie based on a single frame pulled out at random. Checking at home, a couple of times a week, ideally around the same time of day, sitting calmly with your feet flat on the floor rather than rushing in from outside or right after climbing stairs, gives a far more honest picture of what's actually happening with both numbers and with that gap between them over time. I encourage my patients to keep a simple little notebook by their cuff, just the date and the two numbers, nothing complicated, and bring it to every single appointment. The patterns that notebook reveals over a few months tell us far more than any single reading ever could on its own. The way a weather forecast built on weeks of data tells you far more about the season than checking the sky outside once and guessing. I had one patient, a retired engineer, who approached this with exactly the kind of methodical precision you'd expect from someone in his old profession, who started not just writing down the numbers, but also noting what he'd eaten, how he'd slept, whether he'd walked that day, and within a couple of months he'd essentially built his own informal study of his own body, noticing patterns even I hadn't specifically asked him to look for, like how his numbers consistently ran higher on days following a particularly salty dinner the night before. There's another connection worth mentioning here, and it's one that doesn't get discussed nearly enough alongside pulse pressure, and that's the relationship between blood sugar control and arterial stiffness. For patients managing diabetes, or even just borderline elevated blood sugar, those fluctuations contribute to the same kind of stiffening we've been talking about in the larger arteries, which means that managing blood sugar well isn't just a diabetes conversation. It's directly relevant to this entire pulse pressure picture too. I've watched patients who tightened up their blood sugar control for entirely separate reasons end up with noticeably improved pulse pressure readings as something of a welcome side effect, a reminder that the body really doesn't keep these systems as separate as we sometimes like to imagine when we're sitting in an exam room talking about just one issue at a time. I think about the men and women in my practice who still take real pride in independence, still drive themselves to the grocery store, still host the family for holiday dinners, still walk the dog every morning before the sun gets too hot. And the thing I want for every single one of them, and for you watching this right now, is to protect exactly that independence for as many years as possible. Stroke doesn't just threaten life itself. It very often threatens the specific, everyday independence that makes life feel worth living. The ability to cook your own meal, to drive to see your grandchildren, to garden in your own back. I want to be very clear about something before we go further, because I don't want this video to cause unnecessary alarm. A wide pulse pressure is a risk factor, a meaningful piece of the puzzle, not a guarantee of anything, and certainly not a diagnosis or a prediction carved in stone. Plenty of people live long, healthy, stroke-free lives even with a wider pulse pressure than what we'd consider ideal. Genetics, overall lifestyle, and a dozen other factors all play their own part in the bigger picture too, and managing it well, with your own doctor's guidance, genuinely shifts those odds in your favor over time. This isn't meant to frighten you. It's meant to put real, useful, actionable information directly into your hands, because in 30 years of practicing medicine, the patients who do best aren't the ones who panic over a number, lying awake at night calculating and recalculating their own readings. They're the ones who understand it calmly and use that understanding to make small, steady, consistent changes, the kind that compound